It'll cost a lot more for taxpayers, billions and billions and billions more. There'll be fewer choices for doctors and health insurance companies that people can pick from for both treatments and coverage. The lines will be longer for medical procedures, and the treatments that you have accessible will be decided upon by the government. They'll decide in the end, they'll really make decisions on, do we want to continue offering these treatments, and there'll be quality of life decisions that are being put into the equation, which is scary.
I think the model of primarily having medical care provided by primary care and trying to decrease the amount of medical care provided by specialists is actually 180 degrees wrong. I think there's no doubt that some of the incentives in specialty care need to be adjusted, but the bottom line is medicine just over the last 10 years has exploded in the amount of information that there is. And no one primary care doctor can possibly stay up on all that. In my practice as an orthopedic surgeon, I see that nearly a half to two-thirds of expensive imaging studies such as MRI were inappropriately ordered. Either they were wrong study or they weren't indicated. So I think ultimately people will get better care and the system will be monetarily more efficient if once a patient's problem does not respond to initial treatment and evaluation, if that patient is then referred to a subspecialist, they will get much more efficient care, both in terms of being helped with their problem and in terms of saving money.
Number one, increase the choices that Americans have. That can be done through allowing people to get insurance across state lines, which they really can't do right now. Portability, letting them take insurance with them from job to job, which will be important to help. Greater use of HSAs. Those give people a wide range of new options, and it makes HSAs really makes people consumers of healthcare in a way that they have a stake involved in it. Those are just some of the ideas we've got that are out there and we're pushing for.
More questions? You think people are buying this argument that more government involvement in healthcare will save money?
It's laughable. When the president can come on every night if he wants and do a primetime news conference, and as long as he's standing up there saying, people, we're going to take over with the government and we're going to save you money. That's laughable. No one's going to buy that. And Americans aren't buying it. They know when the government gets involved, the money is wasted, and in the end, it becomes boondoggles and bureaucracy.